My name is Jean Bellec. I have been a nurse anaesthetist for 10 years and have carried out management functions for 2 years at the Rennes CHU in the emergency department.
All my days are different. For example, on a day working in the operating room, I arrive around 7:45 and directly start taking care of the patients doing the first anesthesia together with my colleagues. During the day, we also have to switch between 2 operating rooms. Working until 6 p.m., that's a typical day in the operating theatre. The requirements for an anesthesia machine are that it's easy to use while providing modern ventilation techniques and fulfilling our safety standards for good patient care.
What's better? Well, what's better in patient care with Perseus, which is more comfortable compared to the anesthesia machines we had before, is that you think more in terms of the patient than of the machine. Perseus offers enough options to ensure that the machine adapts to the patient and not vice versa.
When
we introduced Perseus in the emergency department, the feedback of nurses and anaesthetists was that overall we were dealing with a 21st century anesthesia machine. Easy to use, easy to learn, reliable and simple.
The advantage of Perseus with Vapor View is that one can predict what will happen in terms of gas consumption.
One really wants to work with the econometer, and we want to use the econometer as much as possible, since we want to optimize fresh gas consumption. But there are other options which are ergonomic for everyday work. For instance, the pause function directly on the lower tab. This might seem like a gimmick, but when performing a laryngoscopy, you just have to press pause. And when the laryngoscopy is finished, you cancel the pause and return to the same gas mixture. You return to the same ventilation mode, and during this time, the ventilator hasn't sounded an alarm because it's continuing to work despite there being no patient connected. We're all different, and we all have different skills, but even the most technophobic person finds it easy to work with Perseus.